One more panel before the final preliminary. That's a pretty good energy level. My name is Janetta. I'm a senior policy fellow at the Urban Institute in Washington, D.C., and I'll be moderating this panel on research, evaluation, and data. I was looking at the program. I see written underneath this panel, it says, major developments in the social science of violence, communities, and violence prevention. We'll get as many major developments out into the conversation as we can. I will warn you, we may sneak in some things that might be incremental developments, or even developments that we don't know how major they are at this point. So just in the interest of accurate advertising. A little bit of framing before I introduce the panel and we get started. So I was thinking about the role of the part of the NNSC community that does data research and evaluation relative to the development of the work, and it put me recalling when I was in the master's program at the Kennedy School of Government. David Kennedy was on the faculty then and taught the core criminal justice policy class, which covered a lot of things, but it went in depth on the Boston gun project and the development of Boston's ceasefire. And one of the things that I appreciated about that at the outset of a career where I was working in a number of different research organizations or settings is if you look at the Reducing Gun Violence monograph that they produced out of that, one of the things that it does to a really unusual degree is really tell out in a narrative and clear way the story and what that working relationship between researchers and the practitioners in Boston looked like, and I appreciated the exposure in a clear, explanatory way to what a partnership like that could look like. And one phrase that always struck me in that monograph, and it was when they were describing the part of that work that was about thinking about what exactly the dynamics were driving the youth homicide crisis in Boston at that time, and they had come in, they being David Kennedy, Ann Peel, and Anthony Braga, with the theory that, so much of the conversation about violence had been really around the crack epidemic and crack markets, and what they had as a theory is that in Boston, the youth homicide problem had become decoupled from that. It was no longer about that, and was in fact being driven by fear that the youth had and gun carrying that they were doing around it. And a lot of that was true, but they also had a belief that this was a pretty broad phenomenon happening through a wide swath of youth in the community, and what they described hearing from the BPD folks who were working in the gang units, from the youth outreach workers, from probation, from some of the community partners in the clergy, was actually, no, this is a gang and a group problem. It's much smaller. It's much more localized than that. It's really about conflicts between these groups. And the phrase that they wrote in that monograph was, the authors resisted this diagnosis, which I always appreciated as an unusually forthright way of talking out of the academic experience about that interplay and the skepticism. And one of the things that for me was really important out of that story is they resisted that diagnosis, but in a way that maintained open-mindedness about it. And in the resistance to that diagnosis, what they did with that is that they engaged in research and evaluation and data gathering and knowledge building work around it to see whether it was true, and ultimately concluded that it was. And then Boston ceasefire was in large part an intervention based on that truth that they felt that they had found. And I think that the research and evaluation community in our relationship to this work, when we're at our best, is when we are able to approach it with that sort of commitment and also open-mindedness, a real push to try and find out what is true, to be open to the possibility that what we think is true. And, largely folks in the academic and research community are often become quite attached to the things that we think are true and the way that we articulate them to ourselves, but being open to the fact that that might not be quite right, and to actually pursue what is true, and then be good partners. And part of what that means is taking the knowledge that we're building and figuring out how to translate it and give it over and share it with the partners doing the work in a way that's going to be comprehensible and gives them a tool to figure out what they should do. So building from that framing around the relationship between the research and evaluation community and the anti-violence work that's happened not just through NNSC but around the country over the past 10 years. Very excited to have this excellent panel to talk about where we are now, where we might need to go to share some of the knowledge that they have been building with you all. And so introduce the panel in a second. Everybody's going to get a framing question, have a little bit longer to sort of lay out some of what they are bringing to the table in terms of knowledge, and then we'll go into a more discussion-based question format within the panel, and we'll reserve plenty of time to bring you all into the conversation. So sitting immediately to my left is Dr. Jeffrey Butts, who is the director of the Research and Evaluation Center here at the John Jay College of Criminal Justice, and is doing and has done a million things. One that I will highlight is he is leading the evaluation work on the cure violence replication here in New York City. To Jeff's left is Kyle Ott, who is a data analyst here at the National Network for Safe Communities, where he does work that supports the group violence intervention, the intimate partner violence intervention, as well as their NNSC's international intervention team. He's got 2 forthcoming papers that he'll speak out of, one on the concentration of group member involved violence in the U.S., and possibly, if we're able to get it in, around machine learning to better understand the dynamics of intimate partner violence. To Kyle's left is Dr. Clair White, who is an assistant professor at the University of Wyoming. Prior to going there, she worked at the Center for Evidence-Based Crime Policy at George Mason University in Virginia, where she led primary data collection on a large longitudinal study on crime hotspots in Baltimore, experience that she'll be speaking out of primarily. And then finally, at the very far left, Thomas Apt, who's a senior research fellow at the Kennedy School of Government at Harvard, where he teaches studies and writes on the use of evidence-formed approaches to reduce gun, gang, and youth violence. Prior to that, he was a policymaker in the Obama Justice Department and oversaw criminal justice and homeland security agencies in the state of New York. Thomas also literally wrote a book on the subject called Bleeding Out, which I believe comes out next week. So you're too early to get autographed copies, but you're right on time to get a preview, at least to some degree, of some of the knowledge that Thomas has put together there. So what I'd like to do, and if I may, I'll just turn and start with you, Jeff, is the framing question. I mean, here you are in a room full of people in various ways engaged in anti-violence work, some from the government side, some from the community side, some from probably the academic and research side, or from positions that blend those roles. I'd be interested if you just lay out what some of the new things are, or emergent things are from your work that you'd like to give to this group. What do you think that it's important that they know to inform their anti-violence work, and how do you know it?
Okay. First, I'd like to thank you all for coming. Last night we were all at the reception and we were joking on the last afternoon of a conference where the panel's about research and evidence. We were trying to guess how many would show. The low estimate was 8. And I think the high estimate was in the 20s.
40,
so
I think.
40?
That was there was
Now they're claiming to have high numbers. Yeah.
That's not true.
Yeah. So thank you for coming. I'd like to know who's in the room, first of all. How many people here spend your day primarily working in research? How many people are law enforcement? And social services, nonprofit, advocacy? Okay, good. So when we talk about research in general and what's important and what we each know, so I've been doing research a long time, but I started in on this cure violence work, or specifically violence reduction work, after I came to John Jay. And it's kind of interesting. I see, since Jeremy Travis is back there, I'll tell this story. I came to him and said, hey, we were just contacted by City Council and the Robert Wood Johnson Foundation. They want to know if we want to evaluate cure violence. And he said, great. I said, but isn't this like me coming to you as the head of Coca-Cola and asked to interview Pepsi or evaluate Pepsi? And he said, no, it's research, you find the knowledge, we'll spread it around, go for it. Because John Jay was heavily identified with the National Network and the work that David and Kyle and all their colleagues do here. And over time, I think, like yesterday I made a joke about it really seems like the field is coming together, because when we first started working on cure violence, people would have that same reaction when I would tell them this about the Coke and Pepsi analogy. They'd say, oh, and they would tell stories about how the leaders of these various programs and approaches are bickering with one another and claiming credit. And much of that was exaggerated, and it was probably more true 10 years ago than it is today. So I do think there's been some gains in basic principles of intervention. I want to identify still remnant things that I think people in the field generally don't really grasp. And I alluded to one of them yesterday, which is when as researchers and we talk about research, we usually mean something different and more specific than the way that word is used in general policy circles. So we work in city government, you work in the field, in the community. Usually when people say research, they mean something that they read recently that had a graph in it or a figure, or the person that wrote it had a PhD after their name or a .edu email address. It just means general organized information. And what we mean by research is the careful collection and deliberate analysis of evidence that can establish a causal relationship. And of course, the lens is broad. Research can also mean just finding out basic numbers about something people don't understand yet. But evaluation research and what we're talking about here in terms of evidence of impact, yesterday I objected to people just flippantly saying we cut violence, we reduce violence, because you can't just say violence went down in this city by 40% and it's because the police department did X. Just because X precedes a 40% drop doesn't mean X produced that 40% drop. And when we evaluate cure violence here, we try never to release findings without a comparison. So when we say, here's the trend in shootings in this one neighborhood in Brooklyn over the past 10 years, we don't just say what the trend is and what the percent decrease was. We say relative to another neighborhood matched up with this. And when you match, that means controlling for demographics, population trends. It'd be nice if we could control for gentrification. Turns out that's harder to do than I expected at first. But you try to come up with a neighborhood which is very similar to that and then look at the two trends together. And the difference between those two trends, and it gets more complicated after this, but you want something, for those of you who are non-researchers, you want something akin to an effect size. And the way you write a sentence is, of the 50% drop in this district, about a third of it could be possibly attributed to the presence of this program. And I understand why responsible research talk is annoying or boring to people, because especially in the media, they want something with punch. They want a clear, simple headline. And I made this joke before you, I would never be the person that stands in front of the crowd and said, let's go. You know, I would never be able to rally people, because I would say, well, on the other hand. So you need a balance. But what I would hope to see in the future is that people learn to get counsel from researchers before they make pronouncements about effect. And I don't want to offend the law enforcement people in the back who I saw raise their hands, but police departments are horrible at this. And what I would hope, if I was, potentate for a day, I would say that all police department analytics staff, research staff, the crime data people should be independent of the command structure. Because when I see police departments, I know they're good people in there, and I've talked to them, I've met them, they got training, they're good statisticians, they know this stuff, and they are basically told what to say by the brass. And that really bothers me, because it unbalances or creates an imbalance in the conversation about effect. And I really appreciated yesterday David using language about the community is where the resources need to be, or that's where the real action happens, or he was summarizing everything that works, what we know about everything that works, which means you draw a big border around all the things we've done research on to see. And the phrase I would use always in describing effects was, we know this program helps to reduce violence. Not we reduced, we cut, we slashed, but we know what we did helps to reduce violence. And then you start getting into the metrics of how much help that is. And that's where I would hope the conversation goes.
All right. Thanks. All right, so again, I'm Kyle. I work at the National Network for Safe Communities. I'm a data analyst. I'm not an academic, definitely punching above my weight here on this panel. But definitely excited to be here nonetheless. So I'm not here to talk about, an evaluation of any kind or, what works. Although, of course, I represent the National Network and I'm heavily involved in GVI, IPVI, and our international adaptations thereof. What I'm here to talk about is to really highlight kind of the summary of the body of work that, at least for GVI, that our office has been working on for years, decades, you could say, at this point, and really unpacking, what do we know about violence and what do we know about how it concentrates, right? And what we've seen time and time again, especially in U.S. cities, small, medium, and large, right, is the same exact result that we all know, that you all know, that the research community even knows. We haven't been able to have a paper to cite, at least when it comes to how group member involved violence concentrates in U.S. cities. So that's what our office has been working on. It's been a slow burn. Thomas, I know that you're really interested in having this paper out there, and you asked me why it's taking so long. I have many reasons, mostly because we have lots of work to do and really great work to do, and kind of research is a slow burn activity in our office. So our office really, is at the intersection of research and or practical applications thereof. So we call this exercise a problem analysis, what I'll elaborate a little bit more on in a second. So what we really want to know is, what do we know, right? What is the problem, right? What is going on in a given community, especially if they're coming to us saying, we have a group issue, we have an intimate partner violence issue. Okay, great, right? Assuming nothing, how can we unpack that further, not just relying on administrative data, right? So what we really want to do, and what David has done forever, it feels like, is to talk to the frontline practitioners, right? The people on the ground in the communities know exactly what's going on, right? So we can take that knowledge and really unpack that and produce a report, to build out an intervention, right? So that's kind of it in a nutshell. But what it looks like and what we're really learning, at least for this paper that we're going to hopefully put out there soon. I'm feeling the pressure now about putting that paper out. Should work on it right now. And the key insight there, right, is what David has said, what's been repeated almost ad nauseum, but is a really important finding, right, is that we can identify a really small group of individuals who are incredibly high risk that are connected to 40, 50, 60, 70% of really serious violence. So that's homicides and non-fatal shootings. And this percentage of people is like 0.5% of a given community, of a given city. And we've seen it everywhere, across the board in the US. So in this paper, we're drawing on 23 different problem analyses that our office has conducted over the last 5 years. Those cities run the gamut in terms of what they look like, where they are, what size they are. I can name a few, so I don't have them memorized. So that's Albany, New York, Newburgh, Buffalo, Troy, Birmingham, Chattanooga, Gary, Jacksonville, Kalamazoo, Minneapolis, Peoria, Savannah, South Bend, Wilmington, 2 districts in Baltimore, York, Pennsylvania, and 6 cities that I can't say right now. That's in addition to places that we have continued to work with or starting new relationships with, and we're finding the same exact result over and over again, right? And so the way we do this, right, is to get in a room, sort of like this. Maybe we've done one here, I don't know. And to get a really rich cross-section of different frontline practitioners from different agencies, and really unpacking a question of what do your groups look like right now? What are the dynamics? Who's involved? What are they beefing over? What do they look like? How many people? Et cetera, et cetera, et cetera. And have a rich discussion about that, right? Step 2 is an incident review, which is really tedious, takes a lot of patience. So same group of people. Mostly law enforcement again, but not always. And we unpack 2 to 5 years of homicides and non-fatal shootings. And we discuss, what happened, who was involved, asking many, many different questions. And we go over every homicide and every non-fatal, not just the ones that, a police department might say, these are the gang-motivated homicides and non-fatals. Let's look at these, right? We know over and over again that from our experience in that having a very narrow lens on what is a gang or what isn't a gang kind of really gets in the way of understanding the bigger picture, which what we see over and over again is that it's really loose networks, groups that are really driving a large portion of the violence. And then there's a whole component of what do we do with that, how do we maintain robust intelligence, and where do we go from there? And what we're seeing, and I can talk about a little bit later, right, is that it's really important to institutionalize this knowledge, right? The second we walk away from a city and do a problem analysis, that information is, old, right? This needs to be maintained, and information needs to be shared across different units within a department, across different agencies, when trying to do an intervention such as GVI, right? So there are ways to continue and build off of this information. So the research that we're doing is really just kind of essential findings, but hopefully are finally driving this point home, right? That we see this result in many cities, and I would believe many more that we haven't worked in. And the last thing that I would say is that we're even finding these kinds of results outside of the US. So if you were at the international panel, we found similar results in El Salvador, definitely similar results in Sweden, although we did not do a problem analysis there. So I'll be clear about that. And then there are ways to think about other types of violence, not just group violence, but say intimate partner violence and how that concentrates and what that means and how we are trying to understand, what does intimate partner violence offending look like?
Hello, I'm Claire White, and I just want to first off thank the National Network for inviting me out here to present on some of the research that I have been doing for the past few years. Again, I'm not going to present on or discuss any evaluations that we've conducted, because what I've been involved in is a basic research project. So essentially the last 7 years we have been collecting data in Baltimore on street segments. So a lot of what we understand about communities are drawn from these large communities, census tracts, census block groups, and we've heard over and over again that within a community there's a lot of variation. Communities cannot be generalized as a bad neighborhood and a good neighborhood, because within that there's a lot of good and there's some little streets that are bad, and in the bad neighborhoods the same thing happens. There may be some bad streets, but around the corner there's a really nice street. And what we understand about communities has never really looked at this kind of unit of analysis, a street segment. So I've had the pleasure of working with Professor David Weisberg, who's kind of the hotspot policing guy, and has spent his career showing this crime concentration, that within a community, crime is concentrated on street segments or clusters of street segments. It's about 50% of crime on 5% of street segments and about 25% of crime on 1% of city street segments. So from the policing side, right, that's target resources in areas where we know crime is concentrated. When you mask a whole community as bad or good and implement programs at this kind of widespread community level, you're kind of wasting resources in a sense. But what we wanted to do, and the project that we conducted in Baltimore was funded by the National Institutes of Health, was collect residential survey data at these street segments to understand what people, what their lives are like at a micro geographic place. And this has never been done before. So everything we talk about and know about crime concentration in communities is disconnected, because we really don't know what's going on in the lives of those people on these very small places. So we have all this data, and I'm in the same position where why aren't there all these publications out? It's like, well, we've spent 7 years collecting data. There's a lot to navigate. And so I'm really at the front end of trying to understand what these micro communities look like, learning about what people experience, what their health is like, how they get along with their neighbors. And we can say that people who live in disadvantaged communities have health problems, but to say that at a street segment level has not been done. And so we're starting to kind of, as Jeff put it, basic numbers of things we don't know about. And I'll say the same thing I tell people who are participating in our survey. They're like, well, what's going to come out of this? We can't develop programs and policies and evaluate those programs on things we don't know about. So yes, we know crime is concentrated, but if we're going to impact if we're going to develop a program that targets that crime concentration, what else is it impacting? There's people in these places. It's not just crime. Many of these people still want law enforcement. They want police officers to come to their block, despite lack of trust with the police, especially in Baltimore. From this larger kind of project, we developed a pilot study that partnered police officers and social workers to go to these high crime areas, knock on doors, and try to connect people to services. Not after a call has happened, not after a crisis has happened, just go to these places and ask people if they need help. And there was a lot of the department saying no one's going to talk to us. This was right after Freddie Gray. They're going to throw rocks at our officers. Our clinicians, we thought about, well, maybe we just send clinicians, social workers to these streets. They're like, we want the police. These are really high crime areas. I don't want to go in there by myself. And so that partnership that sometimes we think can't happen, it did happen. And it was very small, and it's still an idea right now, but we tested it out and found a lot of support that we can target resources in small places and that people want that targeted intervention, but they don't want the police knocking down doors and doing these drug sweeps and things like that. They want the police to come in a non-law enforcement role, and that social worker provided that balance and help them. We often are so focused on crime, and crime is the outcome in reducing crime, but there's so many other aspects to these people's lives that we need to consider other outcomes and other potential avenues to affect people's lives that maybe then in the long term would have an effect on crime, rather than kind of just this cause and effect program, crime reduction. What is going on that's leading to that? Is it connecting people to resources, providing basic needs, or is it instilling building informal social control among the residents who actually there is still a lot of trust? So that's another kind of thing that we think that people who live in these high crime areas don't know each other, they don't talk to each other, there's not that community that we want there to be, but it is there. They just don't know how to activate it. But I'll talk more and leave it to Thomas.
All right. As you heard, I have a book coming out next week called Bleeding Out: The Devastating Consequences of Urban Violence and a Bold New Plan for Peace in the Streets. So I have a lot to say on this subject, but I'm going to boil it down for you in about 5 minutes. In the book, myself and my colleagues and some assistants reviewed the evidence from hundreds of individual impact evaluations and these impact evaluations were from basically all the anti-violence and anti-crime programs we could find that were rigorously evaluated through quasi-experimental or experimental designs. But in addition to that, and we came up with some broad findings based on that comprehensive review. But in addition to that, I really wanted to put the evidence and the science in conversation with real people who had, researchers are real people too, I don't want to get the wrong idea, but with people who had experienced violence firsthand, and to really create a feedback loop between the academy and the community. And what I found, what somewhat surprised me was that the two perspectives were pretty closely aligned. They mostly saw urban violence the same way. And they mostly agreed about how best to address it. And so that was interesting to me, that researchers, while using different terminology and vocabulary, really agreed with former gang members, street cops, and moms who had lost sons and daughters to gun violence. And so we boiled down what we learned into three broad fundamental principles for urban violence reduction. And those three principles are focus, balance, and fairness. The focus principle really builds on what you've heard from both Claire and Kyle, that urban violence is sticky. It concentrates among very surprisingly small numbers of people and around surprisingly small numbers of places. And so violence, while we think of it as this massive overarching problem, it's an extremely serious problem, but it is an extremely concentrated problem as well. And so, generally speaking, your solutions should match the nature of your problem. And what we see in the research is focused programs, generally speaking, looking over dozens, if not hundreds of strategies, outperform more broad, general programs. The second principle is balance. And that principle basically acknowledged that in the research, we found enforcement-heavy approaches that were effective in reducing urban violence. We also found non-enforcement approaches that were effective in reducing violence. And in fact, when we looked at cities, we really couldn't find any modern examples of a city that had really just exclusively arrested its way out of the problem or exclusively sort of programmed its way out of the problem. And so what we saw is that really to be most effective, and really also to simply reflect human nature, which responds to both positive and negative incentives, you need to have a balanced portfolio. I think I chose the word balanced instead of comprehensive. Comprehensive is a word that we toss around a lot in this work and in policy areas generally, and I certainly have been very guilty of using it in the past. But comprehensive is often an excuse to sort of not make hard decisions about what not to do. And it's often hard to maintain fidelity to that principle of focus if you turn right around and say we're going to be comprehensive, because then you're kind of doing everything. And so it's important to, and that's why I use the sort of more modest term balance. And then finally, we kind of have to recognize the moment we're in with the principle of fairness. American criminal justice is suffering a crisis in confidence. And you've heard that over the past 2 days, and it's very much real, and we have to acknowledge that. I have to say that the science around fairness and legitimacy and justice is not as strong as the scientific evidence that we have around these principles of focus and balance, but it's extremely important. I think we have suggestive evidence in terms of what I view as a very encouraging approach, procedural justice, that when we use these procedural justice strategies, we can change both officer and community behavior. But I do, and Jesse is going to go into this in much more detail, but I do think that we need more evidence on this subject, and that the evidence currently is sort of encouraging but suggestive, not definitive. And then I just want to sort of wrap up by saying, okay, I've identified these 3 principles, and most of you in this audience probably knew those already, and you're probably thinking to yourself, these are pretty obvious. And to you they are, but unfortunately, they're not obvious to the public, and they're not obvious to most policymakers. And one of the things that we say at conferences like this is we say, we know what works. And in my experience, and I've said that myself in the past, but what I don't think we recognize is the we in that sentence is an exceedingly small community of people. And we have to grow that we. We in this room probably do know what works, but have we communicated that effectively to our broader circles and others? Often I don't think we have. So how do we put these principles into action? I think the basic thing that you need to do is take a what people believe to be a massively complex, sort of hopeless, intractable problem, and break it down and disaggregate it into very simple, very concrete parts. And so in the book, I outline strategies based on who your hot people are, where your hot spots are, and what are the key behaviors you need to avoid around those hot people and in those hot locations. One of the key behaviors being, of course, the carrying of illegal firearms and certain types of group or gang activity. And so I think that when you look at urban violence, it feels too big to address. But when you look at the evidence, you can actually see that this problem can be cut down to size. It doesn't make it easy. Everyone who's spent time in this knows that there's lots of heartbreak along the way. But if you look at Boston and you look at the Boston Regional Intelligence Center, and you say, "Oh, Boston is this city of hundreds of thousands of people, millions if you take the broader area." But if you look at the BRIC data and say, "You know what? It's really 350 people we need to worry about." When I was here in New York, when we started GIVE, the New York State Gun-Involved Violence Elimination, and we decided to go into Newburgh, the most violent, surprisingly most violent part of New York State. Newburgh is, 50,000, 100,000 people. And I remember we talked about this before we went in, and I said, the list of people needs to be small enough that we can memorize the names. That's the level of focus for that type of community. And it's with that type of focus that you get efficiencies. So basically, you put these principles into action by developing some people-based programs, some place-based programs, people-based programs like focused deterrence, place-based programs like urban greening or hotspots policing, behavior-based programs focusing on gangs and guns, and then you have to make sure and constantly ask yourself, are we being focused, are we being balanced, and are we being fair?
Thanks, panel. So to make my contribution here, so Jeff started by grounding us in kind of laying out particularly like strong evaluation, the way you want to set yourself up to make good causal claims. And you may be wondering, well, what does it look like when you're not able to do that? But, I've got you covered because I can bring a situation like that to the party. So for folks who were at the plenary panel this morning, you heard me talk a little bit about some of the results around the community surveying and community perceptions in communities most affected around legitimacy and treatment by police and things like that. And you may have also heard that I said lots of things like promising or, implies and, maybe a little bit maybe. And you might have thought, boy, that guy's a real good, careful researcher, and maybe that's true. But I think part of what might be helpful in situating that work and findings into context is to talk a little bit about what it is, but also what it isn't, and then what needs to happen next in terms of even what we know about deliberate trust building and knowing whether or not you've succeeded. So the national initiative I mentioned was 6-city effort, and in the early days of thinking about how we were going to do evaluation around that, there was some imagining, like some of that trust building work will probably be very neighborhood specific. So what we can do is within cities, we can try and pair neighborhoods that got a lot of NI and that didn't get as much national initiative or any, and then that will be our basis for comparison, at least at the outset. But what developed with that intervention is, as they were thinking about how they were going to do that, they're like, no, part of what this needs to do for trust building is it needs to be deep organizational culture change in the city police departments. Part of what that means is when we do procedural justice, we train every officer in the department, and I'm implicit bias too. And then you're like, okay, well that means every place in the city is now getting that, and we're going to do a lot of policy change. And we're like, okay, well that'll also be citywide. And as it evolved, because of the ambition of it, and I think this is fair with the with what they were trying to do, we realized actually there's not going to be that much variance in how much national initiative this neighborhood in Minneapolis gets versus that other one, or at least not separate from just how much policing they get in general. And, when you're doing something that's really fundamentally about pushing and building the practice knowledge base, sometimes what you have to do as an evaluator is figure out what's the best way to do knowledge building in tandem with that. And so, what we have around the community surveying there is, we went in, we did 2 points in time, and we have pre-post within a city, what that looked like in those neighborhoods in 2015 versus 2017. As I mentioned, I think we were surprised in some degrees by how much improvement we observed, at least in those survey samples, in terms of how they saw police legitimacy, trust, the honesty of police officers, perceived bias. But what we're able to say is we came in and asked those questions and gathered those views before the national initiative started, and we came back 2 years into that work. But of course, what happened within that period of time was a lot of national initiative stuff, but a lot of other things. And whether, it's things that might suppress people's trust in police. I think a lot about Minneapolis there, where if you're familiar with, what happened there from 2015 to 2017, 2 very high-profile shootings of residents of Minneapolis by the Minneapolis PD, as well as the killing of Philando Castile, not in Minneapolis but right proximate to it. And then conversely, in Fort Worth, which is one of the sites during that period between when we did the survey waves, was when the sniper, if you recall, killed a number of Dallas PD officers, which is the city right next to Fort Worth, which you might imagine would trigger a lot of feelings and sentiments supportive of police. And so we're at a situation where I think we've got some very promising, but in some ways we have to discipline ourselves about the level of excitement that we bring to that, because a next stage there, as we think about deliberate trust building and trying to really move ahead both the practice and the science of that piece of the anti-violence agenda, we still have a lot to do in terms of really setting ourselves up to make strong causal claims. And, I'm in the position as someone who's been involved in that work around the national initiative of disciplining myself to say with confidence what I think the difference is between what people thought at those 2 points in time and what we really want to know, which is how much did the national initiative work in itself create that difference, if it's real. So that's to give that a concrete example of both as you're building the early knowledge. And in many ways, Boston ceasefire was like that. They were having to go after the fact and find similarly situated cities because, as Anthony said, if you were there at the awards banquet, they weren't able to randomize. It was not at a stage where that kind of way of doing it out. And really, often when you're advancing this area of practice, it doesn't start as a research project. A lot of these things are about advancing practice and then building up, your sense of what the questions are and how you can go about doing the ability to prove that you actually caused the change that you observed. So what I would like to give to the panel as a first question, I want to pick up on the hot spots in particular. So one of the clear things you've heard here and that's been emergent is the need to focus, and some of that is on people and some of it is on places. And I feel myself that one of the real differences coming into spaces around this work now as opposed to years past is the array of things around people that are being deployed beyond deterrence and enforcement is much broader, whether you look at models like advanced peace, interventionist work like cure violence, connections to social services and positive supports, I think having become much more robust. I feel that in talking about the practice base here, we're really in a position to say we have figured out and are deploying lots of different ways to engage with that small group of people at risk other than enforcement, although enforcement remains part of it. But I'm mindful of, in the plenary this morning, Maisha Braden was really naming hot spots policing, the place-based part of that, as at least in a much more problematic way about what might be done there. So I would be interested to ask the panel, and I may start with you, Thomas, because at least you named urban greening, so you named one thing other than the deterrence. What do we have around that geographic piece, the hot spots? What are we doing, or what might the evidence suggest that we could do aside from greater police presence in those places?
So just a word on hotspots policing. I think hotspots policing is a very interesting area in terms of the research because there's been a lot of research done on hotspots policing. And it's been, and a lot of it has been very high quality. And so we can come to some strong conclusions. And one of them is that in terms of producing statistically significant improvements in crime outcomes, hotspots policing works. But as Jeff said, when you look at the effect size is actually quite modest. And so maybe the more accurate way to say it is that hotspots, in terms of crime outcomes, on average, helps a little. Certainly, it does not have the same effect size as something like focused deterrence, which is a significantly larger impact. And also, I think that we see that issues like stop and frisk, which I really see as sort of an outgrowth of a hotspots policing poorly done. That hotspots, if done poorly, can have all of these negative collateral consequences. I don't think that there is a place-based enforcement alternative to hotspots at the moment. And so what we need is, we don't need the standard hotspots, and we certainly don't need the zero-tolerance hotspots. But if you're talking about hotspots policing that's done in collaboration with the community, that is extremely focused and intelligence-based, as it was in Philadelphia, which had a very successful hotspots experiment that was then, if we're being candid, was then expanded into more of a zero-tolerance approach, lost community support, and lost effectiveness. And so I think that there's nuance around hotspots. And then to get to the substance of your question, I'm sorry I went on too long, is there's not a lot of great evidence on environmental crime protection in terms of changing the physical environment and social environment of these areas. We've been talking about collective efficacy for decades. There is very little causal research that you can design a collective efficacy initiative, test it, and come to some kind of outcome. CEPTED, which we've been doing for decades, has massive amounts of people deployed, billions spent on it, has very weak effects. And there's some emerging evidence on urban greening, which is encouraging, but I think is not sort of powerful. Is not sort of fully developed. And so I think what we know, broadly speaking, is that we need to focus on hotspots, but we need to have that balanced approach. We need to have some type of enforcement mechanism, and we need to focus on investing primarily in removing blight, not creating grand structures, but removing blight that is criminogenic, abandoned buildings, things like that, and restoring city services. There's some good evidence, including a very recent RCT in New York about street lighting. If we do those things, then I think the next step is to focus on these micro-communities. We have this very broad sense of community that's very amorphous and very hard to evaluate. I think the better idea is go to the hotspot and look at the micro-community around that. Who are the residents of that housing project? Where, who owns that business? Who owns this? Engage in those. We need a much more concrete and focused sense of community.
So what I'll touch upon is discussing this micro community and what we've found in our data and how that may impact the ability of police to effectively conduct hotspot policing. So when we say hotspots policing, it's just this kind of idea that we send officers to these places to provide a more targeted patrol on those streets rather than these large districts and police beats. So our study, we had a whole array of questions about health and how health affects your ability to go about your daily activities, going up the stairs, lifting groceries, vacuuming, right? All of these things that we can impact our ability to successfully, possibly even work with the police. So in our hotspots of crime, we found, and we have a paper out that says that they're not just hotspots of crime. We're so focused on crime, but what other things are in these places? And there's a lot of health problems. And when we talk about hotspot policing and the partnership that's important for policing to be effective with the community, health may impact these people's ability to work with the police. If they can't get to the door, if they can't get down the stairs of their row home, if they have mental health problems and are fearful of the police, if they call the police, that partnership and that open line of communication between the community, these micro-communities, and the police may be impacted. And so we have to consider what other characteristics there are among these residents of the street that can impact the police to be able to do their job effectively. So yes, policing may work when hotspot policing may work if all the residents can actively be part of that intervention. But if they have health problems and are not able to physically do the things that we need them to do for the police to be effective, that's something that we can address differently. So it brings in that idea of not just using law enforcement, bringing in social workers, bringing in health professionals that can address some of these other needs that then may impact their ability to work with the police and build collective efficacy. So we talk about how do you build collective efficacy? We know places that have high collective efficacy have little crime. Well, now I'm going to kind of go on a sidetrack on measurement. So I'm a survey methodologist. We don't always measure things accurately. So a lot of our collective efficacy measures are willingness to do something. Are you going to call the police or do something if a kid is jumping on your car or just says something disrespectful to an adult? In a crime place with little crime, those are all hypothetical. It's what would you do? But they're never actually confronted with having to do those things. And so we have this measure of something that's purely hypothetical versus someone who actually lives in a high crime area. When they answer those questions, they have actual experiences to base them on. So we have to think about how we measure these things, what they actually mean. Are they actually representing the idea of informal social control? That informal social control doesn't have to be activated in a place with little crime. And we say that has high collective efficacy, but we really don't know. And then the other, when you were talking about police legitimacy, that's another area of measurement that I believe is very outdated. When we asked questions about police legitimacy, trust, fairness of residents of Baltimore, they did not know how to answer those questions. And our field researchers were like, how do we get, they don't know how to answer it. They're trying to reframe the question, which is a big no-no. Don't reframe the question. So you have a lot of these, they're like, yeah, I trust them, but only sometimes, or if you're here, then I would trust them and they're fair. So we need to go back to some of these core concepts as criminologists, as researchers that are trying to measure these ideas, and some of our measures are very outdated. That we are not actually measuring the historical context of policing in these neighborhoods and the criminal justice system. So when you just ask, are the police fair, there's this history behind it that we're not capturing. So I think we need to, when we're talking about the places in these micro communities and trying to understand what these people's lives are like, we also need to think about our measures and whether they're actually applicable to the people that we're talking to.
There are several topics in this field which I know make my blood pressure go up. And one of them is when, as soon as you start talking about crime and violence, people immediately start talking about policing, as if that's the solution to crime and violence. And it's a response to crime and violence. I was once in a conversation, I forget with who made this leap of logic and said something like, well, we know the only things that work are problem-oriented policing and cognitive behavioral treatment. And I said, wow, because I was about to go to Greenwich, Connecticut. That place must be crawling with cops and therapists, because I looked at the UCR and there's hardly any crime there, which brings up your idea of crime-free places. So we have direct, observable information that the reason communities are beset by crime is about something deeper and more profound than the absence of police and therapy. We just choose as a society not to care. So we say, well, these communities, they're horribly, decades of poverty, horrible housing, no one has job opportunities, schools suck, tax base is horrible, but that's too bad. We'll just go in and make sure that the people who are like the hot people don't misbehave. And I understand you can do that statistically, but it reminds me of, you put a bag of microwave popcorn in the microwave. What am I trying to say? Microwavable popcorn in the microwave. And it's like we study which kernels pop first, and we try to understand the characteristics. Is it where they are in the bag? Is it their size? Is it the color? Which ones are going to pop first? It's the heat. And can we at least address this problem, or at least confront it? And it's really easy just to be pessimistic and say, that's too deep, that's too broad, we're never going to get there, so screw it, let's just give up, and let's just do policing and control. And I just want, as a researcher, to say, please can we always remember that there's a reason why the young men in this community grow up full of anger. And it's not because they didn't have enough therapy when they were in school. There's something deeper going on. The second thing is, I irritate David Kennedy when I say this to him, but I think if we're going to talk about approaches to dealing with violence, instead of just talking about effectiveness, we should talk about cost effectiveness. And he doesn't like it when I say this, but the model of focused deterrence presumes the availability and occasional deployment of the justice system. The whole concept of focused deterrence is we do what we can with street outreach and community resources, and if they don't play along, we're coming after them with prosecution and imprisonment. And that's part of the model, which means those tools have to be there, which means you have to pay for them. And he says, well, no, that's not part of the model because those things are already there. They shouldn't be included on our cost ledger. And I think, okay, compare that to cure violence. Maybe cure violence doesn't have the same effect size, but cure violence has an effect size. It can, as I said before, it can help, it can contribute, and it's cheap relative to everything else. So people in New York feel like we're spending a lot of money right now on cure violence because the allotment across the city in various neighborhoods, I think it adds up now to almost $20 million, which seems like a lot of money. And we've just been asked by the city to try to do a cost-effectiveness analysis. And when you actually come up with, and I know this is in your book, Thomas, I saw some of it, what's the dollar impact of a shooting? What's the dollar impact of a death due to a shooting? You don't have to prevent many shootings to justify the cost of a cure violence program. The actual cure violence budget, I think, in one community is relatively, it's like $400,000, $500,000. That pays for 4 or 5 workers, some office space. If you prevented 3 shootings, you would pay for that program. And when people complain about a $20 million budget, I have to say, you realize NPD consumes $6 billion a year? I mean, let's talk about relative effectiveness and relative payoff from investment. And the last thing is, and I'll refer to Thomas again because he knows I'm going to say this because I said it to him once and he said, oh, you always say that. So I'm going to say it again, which is if you're judging the impact of this field by scraping together all the high-quality studies and just looking at their effects, you are allowing your knowledge to be driven by people who do not have your interests at heart. That the reason we have research is because someone paid for it. And I analogized this once. It's like going into a dark room with a flashlight, and the only thing you learn is where your flashlight points. And in this case, the people who paid for the flashlight and point it have certain class interests at heart. And that means government funders, that means foundations. They have a certain perspective on crime and justice, and they pay for where the evidence comes from, with few exceptions. The independent academic who can do their own surveys, who can do small-scale studies that doesn't need a big budget. But these large projects that rely on effectiveness and rely on massive data collection have to have budgets, they have to be paid for, and people choose which things to invest in. And if you're investing in a solution that involves policing and prisons, the money flows toward you more easily than when you start talking about social workers and community resources, so there's an imbalance there. So that's it.
So I'd like to do one last question to the panel before we turn it over to what the people in the room would like to know. And I think this picks up on this thread, although you may not think that. But one of the questions that I wanted to ask, so much of the conversation about what works and the violence work is about realizing reductions in violence. I think we have seen that in many places. But over the longer term, some communities and places have maintained that reduction in violence, but others have lost that progress over time. And so one of the things I'd like to ask is perhaps a forward-going question is what do we have to bring to bear from the research about the question of what is required to sustain a greater level of peace once it's established, or if we don't have it, what do we need to investigate in order to answer that question about how can, reductions, more safety, more peace when it's realized in the streets, how can you keep that so that that's still a legacy 5, 10, 15 years after whatever the initial, deployment was that got you there? And I'm not going to direct that to any specific person. I see people furrowing their brows and nodding, so I'm sure whoever's microwave kernel pops first can grab their microphone on that one.
Well, I guess I would just say briefly, I don't think there's a lot of rigorous research into the sustainability of these programs. So I think that a lot of this is, trying to make it through with observations and our own personal experiences. This is a criticism that's often voiced of focused deterrence, and I addressed it in my book. And I think that we really have to, and the way I addressed it is that sustainability is an issue for any programmatic intervention. And the criticism, I think that if a program over 3 to 5 years shows significant results, in the case of focused deterrence or urban violence initiative, saves many lives, I think the onus is then on government to sustain, not the program to sustain. And this is a structural issue within our government. In terms of how we respond to it, I think the most promising thing that I've heard is really coming out of Oakland and the very careful work that they're doing right now to really be very intentional about writing this program back into the structure of city governance. But I think they are doing that based on a lot of hard lessons that we've all learned in the past.
I would just like to add on to what Thomas is just saying and to give a small example. So the city of Malmo in Sweden is doing a version of GVI. And right now, there are currently researchers embedded in the process, and they are evaluating the process, which I think is really interesting and sometimes overlooked, at least among what's cool amongst what researchers want to study. But for them, it's really important to understand, how are processes improving? How are we working better together? How can this work from beginning, middle to end? And how can we sustain this? It's definitely part of what they're constantly thinking about as they're about 1.5 years into implementation. And of course, they're also thinking about an impact evaluation down the line. But I want to highlight the process evaluation that's underway there. I think that's an important point to be part of this conversation.
And in some ways, the idea is for them to be self-sustaining. My joke about Greenwich, Connecticut was you don't have to keep going to Greenwich and infusing it with services. And once communities come together, and whether we can measure collective efficacy or not is different than knowing it's important and knowing we have to feed it. I also want to just note that I'm not accusing anyone of surveillance, but when I said the words David Kennedy would hate to hear me say this, he walks in 2 minutes later. So.
So as a researcher, I would say we need data. We need more data. We need better data. For a small example from the law enforcement side is the numbers that they track, arrests, calls, don't really get at all the other police work that police officers do. So we need a better system to understand what police officers are doing when they're not responding to calls and not making arrests. Things like wellness checks goes into intimate partner violence. These incidents where some violent act occurs and they look back and say, oh, we had all the red flags, we had all the signs, the police officers knew, but it's not in the data. There's not that stop, that call that says, can you check on my neighbor? I haven't seen them leave the house in a few days. That may be a mental health issue that down the line is going to escalate to a crisis, and then the police respond, and they didn't track it well enough, and then now you have a crisis where someone is shot and killed by the police officer. So having better data that tracks what police are doing during those interactions, who they know, can go a long way. So more data, and also the why, the mechanisms. So if we know these programs work, we're building a body of research that shows kind of what works. The understanding the why, and that is important for replication, for developing these programs in different places that have different contexts, have different resources, different people, but understanding the mechanism of why a program was effective will help it sustain and help to apply in other areas.
So one of the challenges of moderating this panel is there's so much knowledge here that it's hard to get it all out into the conversation, and so I'm going to employ one of the best strategies for managing that kind of difficulty, which is to give off the responsibility to other people, meaning all of you, and to bring you all in to ask any questions of the panel that you might be interested. Will you guys move around the microphones as folks have it? Raise your hand high and proud as you have questions, and we'll get as many in as we can.
Thomas, I'd appreciate it if you take a moment to elaborate more about the concept of balance.
Sure. I guess it is my it's my attempt to synthesize the evidence in a way that's accessible. So when you look over the spectrum of policy interventions, from very heavily enforcement-oriented to exclusively prevention-oriented, all along that spectrum are examples of effective evidence-based interventions. There's also examples of failure along that. But there is no skewing. The effectiveness is not skewed, at least in our review of the evidence, towards enforcement-heavy programs or towards prevention-oriented programs. And in fact, one of the things that I think we see, and so that's a recognition that I think needs to be incorporated. And then also I think there is a political and legitimacy conversation, which is that in order to have a sustainable coalition over time, you're going to have multiple constituents. And those constituents believe different things about crime, and they need to see different things reflected in that effort. And some of that's a matter of evidence, and some of that's a matter of values. And so you're going to have a certain part of the community that cares deeply about so-called accountability. They're going to want to see some type of accountability measures built into your broader portfolio. The same thing is true of people who care deeply about the accountability of the system and what it's doing into individuals and finding alternatives to enforcement. So my view is that if you want to sustain this work over time and you want to be true to the evidence, you need to have a balanced portfolio.
This question is specifically for, I believe, Claire. You said that we need more data and better data. My question is, what would more data look like, and how would you know that it's better?
So in terms of more data from a law, I'll just speak from my experience with law enforcement and collaboration among agencies. So maybe not necessarily more data sharing, more ways for agencies to, particularly health data that's very confidential, right? Finding a way for that to be able to be shared with police in some capacity so that the police aren't coming into an area or responding to a call and not really understanding the people that live there. Except from the crime perspective. And I talk about like wellness checks or those type of things. This police work that is not documented. So when I say more data, I mean what the police can, every interaction they have needs to be somehow documented. If we're going to assess police in terms of whether they're a good police officer, we need other ways of assessing that besides just calls and arrests and reports, because there's a lot of good policing that goes unknown. And so we need to have a better way of tracking these calls to people that are in distress, and having it not just be a line in the data when you have hundreds of thousands of calls for service. And you're like, okay, well, how much of those, if it's a mental health, so I do a lot of mental health work as well, is it someone who's calling about someone on the street that's displaying symptoms of mental illness or drug abuse, or is it someone calling on their own family member? You have to navigate through just tons of data to be able to get that information, and it's not really accessible or usable from a research perspective. So having more checkboxes that make it easier for police to document how they're spending their time, how the interactions went, following up with officers from more of a, what was your shift like? Was anything odd? Having some more of that information, and then we can better assess when police are doing a good job besides just the numbers.
And if I could add in, I mean, to start at a basic point, I mean, something commonly available other than crime would be very helpful. So to speak out of the national initiative evaluation that we did, you know, we wanted to do a lot of things looking at administrative data about what happened to those departments, and every single one of them, except for one who wasn't able to give us anything, was able to give us data on crime, which is good, but I mean, this is a trust building initiative, so if it had impact on crime, that would be sort of a second order effect. You know, some of them could give us some data about use of force, for example. Maybe they had it by race or ethnicity because disparity was very important there. Some had data about stops, some had it for only traffic stops, some had it only for pedestrian stops. So even to do any kind of apples to apples comparison about what departments were doing based on their own data was, I mean, it was, I mean, you kind of knew, I don't want to say too shocking, but I mean, you really saw when they gave us the data, like how, I mean, you had to tell 6 short stories. You couldn't talk across them. And then, you know, the trust data, I mean, you know, I said a little bit about the limitations about what we were able to do with the community survey, but that was a tremendous amount of effort to go out and get this information about how people in the communities were viewing the police. And one of the reasons, if you were at the panel, David talked about how bracing that was for a number of the departments. Part of it was they never had data at that extent about whether, you know, what degree of trust they were viewed with legitimacy. Did people think they were acting with bias? You know, they had never had that. And there's so much effort to try and do things around building legitimacy and trust. But for the most part, you have to go out and make that data. Police, you know, and government is increasingly data driven. But on things like that, you really don't have a whole lot to look at to understand how much trust there is, whether people think that, you know, any agency of government is being fair. It's a huge gap, and there's increasing recognition of how important that is. But a lot of places, not just in policing, couldn't tell you, do people trust us more now than they did a year ago or 5 years ago or last week? I mean, that largely doesn't exist, and often it takes tremendous resources to make anything like that information come into existence.
I just want to add, surveys are always expensive unless they're very small samples and rare. So the best investment you can make is to take advantage of data that comes out of natural behavior of people. So like here in New York, we're trying to evaluate cure violence by scraping all the 311 calls. And there's definite interpretation problems with that because people, that could be an indicator of gentrification more than well-being in a community when people start calling 311 to complain about neighbor noise. But any agent, and the other thing I would say is look past the police. Like you use the phrase crime data. I'm always saying to people, there's no such thing as crime data. There's data about police activity, reporting, complaints here in New York, arrests. That's all law enforcement activity. There's no such thing as crime data other than the criminal victimization survey, which is intermittent and probability based. So health data, we're using hospital data. We know everyone who's come into an emergency room or a hospital in New York for a 20-year period or more who was there because of a gunshot injury. And we know where they lived at the time they entered healthcare, entered the medical system. So that's really important data because it's a true measure of injury. It's not filtered through the self-interest of various agencies. The only filter is it's the hospital agencies, it's their billing system. So they charge things and diagnose things in order to get payment, and we get that data, but it's closer to the moment of injury and to the reality of injury than some other system.
And I wanted to say one other thing is it's also when law enforcement, a lot of times when you designate a call or a crime, it's a one category, and it can be as simple as allowing for a call to have 2 categories. So domestic violence, how much of domestic violence is actually related to alcohol abuse or mental health problems? That if they could simply say domestic violence, and is there a mental health issue involved in this? Yes. So it looks like, and when I look at the data in Baltimore, it's about like 7% of calls for service have a mental health issue. There's, I would bet, a lot more of calls for service that have a mental health issue related, but it's not being captured in the data. And so having the ability for officers to check off kind of multiple things that are going on during that call or that crime that are more multifaceted to see what else is going on in that call.
Thanks very much. My name's Anthony Morgan from the Institute of Criminology in Australia. So we're currently, and Kyle knows because we brought him out to Australia back in February with Rachel Taisha, we're having conversations about introducing a focused deterrence approach to outlaw motorcycle gangs in one area, which is prominent kind of in terms of group violence, prominent issue in Australia, and the other is around domestic violence. And I think we're building a good evidence base around the problem in both of those areas, around kind of the idea of concentration, very good evidence around concentration. But when we talk about focused deterrence, we're talking about an approach that's imported from elsewhere. And we come up with that constant criticism that the evidence base is from America, and the group violence or the domestic violence problem is different here. I guess I'm interested in the panel's views, probably other than Kyle, because I've heard his views, around how we build a compelling case for introducing something like focused deterrence in an Australian context, and how we build a compelling case based on the data we have on the problem.
And I'll just note, you don't need to deprive the rest of the room of Kyle's views. Our level of exposure may be varied.
It's all good.
I'll just say quickly, I think, I said yesterday I agreed with 90% of what David said during his opening, and one of the things I agree with is burrowing into, like looking inside the black box and establishing causal relationships within components of an initiative and not treating it as a philosophy. Say, well, here's what we know works. When you do this, this goes up by 40%, and when you do that and you do it well, it goes up by 22%, and to have those mechanisms and get away from the fact that they say to you it comes from America. Hopefully that wouldn't matter if you could burrow in and look at individual components, and then they wouldn't be culturally connected. That's what you're going to say.
Not exactly.
Earlier in the talk, you did that analogy about the flashlight and the funders and all that. So what would you recommend funders do or not do so as to diminish the impact of that when the goal is to really know what's going on and to really know if these programs have impact?
So my instinct is to have like a citizens committee that determines research investments. The risk there is it becomes blatantly political and ideological, and so you need to have a balance. But to somehow recognize the risk that when I've heard stories about people who've been in leadership positions in various funding organizations, and it's scary to me the extent to which their personal opinions drive the decision. And I would say their class basis drives the decision. When you come from wealth and privilege, you tend to see the world through the lens of wealth and privilege. And I don't, there's probably a good solution to that. Like I forget the name of this, but the people who invented, do you remember this like voting experiment where, I can't remember now, but it's like this massive voting experiment where instead of just having a single vote, you have people get together and discuss and then vote sequential times. Something like that, where you get the community to deciding this is the problem we need to solve, and we want to know the answer to these two questions, and not just trust the mayor or the foundation president to make that choice.
So I think that one thing I often see in terms of the sort of position of researchers in this area and other areas of criminal justice is people are either overly deferential or overly dismissive. And my view is that reducing urban violence is partly a matter of science and partly a matter of art. It's partly with the head and it's partly with the heart, and you can't neglect either. So in terms of developing your research agenda, I would suggest putting community members and frontline practitioners who are directly involved in the issue that you want to impact in the room with researchers, lock the door, and don't let them out until they come up with a joint answer.
You may have just invented incarceration, just to note that.
One other thing there. I think just in terms of research, we are spending far too much, I don't want to say far too much time. We're not spending enough time on aggregation and synthesis. We are producing study after study after study, We don't have enough work like the Campbell collaboration. I'm on the advisory board, full disclosure. We're not paying enough attention to doing the careful work of aggregating all of these studies and talking about and explaining them in a careful way to people. So I think foundations should be doing more work like 3IE with gap maps, with systematic reviews and meta-analyses.
Just wondering if you could talk a little bit about implementation and research implementation science. We've heard it, I think, a lot more with community corrections and things involved with individual people, but I haven't heard a lot about it today or at this conference this week, and was wondering if you could talk a little bit about research on implementing these programs in different jurisdictions. And specifically fidelity.
So, for a while I was very interested in implementation science, and I gathered a bunch of it together, and I looked at it, and I went through a few studies, and the takeaway sort of ended up being like, do a good job,
Yeah.
and I think it's important to sort of study things in a systematic way and to get some of those results. But a lot of implementation, when you're not talking about sort of fidelity of the model, is simply about sound practice, sound management, making sure that you have leadership transitions and all of the things that any organization needs to do well. And it clearly matters. There are studies that say that how a program is implemented actually matters more than the program design. So it's clearly important. In terms of fidelity, I think it's really, this is an area where you have art and science. Because on the one hand, if you're not paying close attention to what makes a model special, you'll lose the key to its effectiveness. On the other hand, if you are mechanically applying an intervention from a different context into a new context and not adapting it at all, you're going to come up with external validity issues, and it may not be successful. The best answer that I've been able to come up with is that you need people to truly understand a model before they adapt it. And so, for instance, I'm focused on primarily on urban violence in the United States, but I do a lot of work in Latin America. And I think a big question is sort of who are the people who are going to implement programs if we're going to import them. And I think one of the things that I increasingly hope is that we will have people from different contexts coming, and this is actually happening in the national network, which is employing lots of people from lots of different places. Those people will really get under the hood about what makes focused deterrence or the group violence reduction special, and they will know. I think it's second best to have some gringo from Harvard come down who's trying to be very conscientious and trying to be very careful, but is limited by their perspective. The best thing is to develop that local capacity, and so that they can really think it through themselves.
It's also really hard to do. Unless you can observe implementation, you're trusting other people to report to you. And I was doing a project once with, I'll just say, a large government agency who told me they were collecting information from all the various contractors that were doing this thing they were paid to do. And then they would aggregate it all together and call that their implementation data. And I said, well, how do you know this is real? They could be lying. They could make this up. And they said, well, we give them a lot of money. And I said, that's why they lie. And I remember in my early life, I was a social worker at a low level, and I remember being pressured to fill out the forms for the court that comported with the federal regulations that required us to do certain things. And I saw fraud going on among very good people who, with all the best intentions, because they knew they had to report this in order to keep the contract flowing, to do all the good work they were doing for the children of that community. It's tough. Unless you can do direct observation, you're relied on administrative data systems, which have to be scrutinized heavily.
I think there's just something implicit to tease out in that, and it reminds me of a very surprising finding for me when my colleague Chris Winship and I performed this meta review, which was that we found that among the most successful programs, they had this in common, that they were all implemented well. But one of the things that when we went to the programs and they asked, how do you do what you say you do consistently? And they said, well, we have an evaluation team, and they're on us all the time. And I think there's an interesting connection, which is that employing researchers and employing evaluations really helps keep people honest in terms of implementation. So that's yet another reason to do research.
Yeah, I would say if you can partner with a university or something like that, researchers that can help you develop kind of maybe the instruments and the forms to have a process evaluation, to try not to make it more paperwork for the people working, but still having those simple, how long were you there, what did you do during that time when you were interacting with people, that you can see, and that speaks to what I talked about with the mechanism, see what's actually going on and why it's working. And then if it doesn't work, you can go back to that data and see where did you veer off, what didn't work and what did.
I think we have time for exactly one more question if we have it in the room. We'll try to answer briefly.
Mr. Jeffrey Butts? No. Okay.
Thomas.
So Mr. Thomas. Sure. Okay, so this question is specifically for you. You had mentioned, and I found this very interesting, that the government would be the onus for sustaining a program and the results of the program if over a period of 3 to 5 years the program was successful. Why do you say that?
Well, I think that we all, addressing urban violence is a collective responsibility, and I think it is potentially too much to ask of individual, the sort of operators of individual programmatic interventions to solve the big questions of, how does this eventually weave its way in? I mean, why do we have people in government if not to answer these questions, if not to say, here's this very interesting alternative to incarceration that this NGO is doing. Maybe probation could change the way they do business to do it more like this. Maybe parole has something to learn here. And so I think that that's an obligation not just of the programs, although I think they should be thinking about that, as I mentioned. But, learning from innovation is something that government should do. And I think there really is your city is grappling with a recent crisis of elevated shootings. You go all hands on deck and you implement focused deterrence. And focused deterrence brings down that number of shootings. Now that shootings are brought down, people don't care so much about shootings anymore. And so they'd send their money elsewhere and they do those other things. Is that focused deterrence fault? Yep. No, I would say that's governance's fault. And we need to sort of find ways to make the case for sustainability. Is that helpful?
And if I could be real basic, I think the push and the need, and this will sound so simple that it's almost to the point of stupidity, but more and more I realize you have to say it. Government at all levels needs to commit to continue doing what works. I feel like in so many cases where there's a change process of some kind, where we go and do qualitative stuff and people are like, a lot of the staff is resistant. So many times you talk to people there and part of the story is, we built the thing, I gave my heart and soul to it and believed in it, and they killed it. The different mayor came in, different governor came in, different sheriff came in, whatever it was, and because it wasn't there, they killed it. And the degree to which over and over governments in this country, maybe it's all over the world, trash and get rid of stuff that works is shocking, and it kills. I mean, it literally kills people when you're talking about anti-violence work, and it kills the motivation and commitment of people who built those things. You realize so many times you're trying to do change efforts, and you talk to people, you're like, oh, we're trying to build this thing and get people to commit to it, and we're building on the ruins of the thing that worked, that they believed in, that got rid of for no reason related to whether or not it worked. It's a real malady of American governance, I think, not just in this area.
So cynical.
I mean,
on that uplifting note,
that's right, go get some coffee.